How quickly can you really climb the ladder as a nurse? Can you be a charge nurse in a year and a half? Are you ready for that? Hi guys, and welcome back to the Momma Nurse channel. I'm Vanessa, and as you've seen from the title, we're going to discuss my path in nursing. So we're basically just going to touch on each role I've played in my 6 years as a nurse, and then I'll have videos in the future that really breaks down each role and gives specific details on how it was, any details or tips that I think that you guys would benefit from. So this is just going to be like a brief overview, and later on we'll have full videos on each role that I've had. So my path in healthcare really started when I became a CNA. It was at a retirement home where I worked for numerous years throughout high school and college as a waitress. And once I finally decided, okay, nursing is really the route that I'm going to take, I went ahead and decided to become a CNA. So I challenged the test. I passed it on the first try and began working at that facility as a CNA. I only stayed there for a couple months before I actually got into nursing school, and then I moved to a different city, and that's where I was in nursing school and worked as a CNA. So I did that for about 2 years. After that, went through nursing school, enjoyed that, passed everything. Before I took my boards, I actually already had a job. It was back in my hometown. They were having a career fair that I found online, so I went ahead and submitted my information, and I got a call back the next day to give me the info and location and all of that stuff. So I was so nervous. And I was like, okay, let me go ahead and get myself together. We'll discuss interview tips and tricks in another video, but I went to the career fair. I got hired on the spot, and that was on a med-surg oncology unit. So we did have the opportunity to get chemo certified, which I did on that unit, but we really seen a mix of everything. It wasn't just oncology patients, it was like a full med-surg, nitty-gritty isolation patients, everything that you could imagine we kind of dealt with. So I was on that unit for 4 years total, or like 3.5 maybe. So I was a floor nurse there. About 10 months to a year in, I became a preceptor. So I started training new nurses coming in. And keep in mind, I'm like a brand new, fresh out of school nurse. And I started training about 10 months to a year in. I was nervous when my manager asked me to start training people. And I expressed that to her. I was like, am I ready for this? I'm still learning myself. And she really gave me the confidence that I needed. She knew that I could handle it. And we talked it over. I told her, okay, I'll try. If I don't like it, I'm going to tell you and we're going to stop. But once I did it, that's where I found my love for teaching nursing. And it was surprising because I always knew that I never wanted to be a teacher. That was just never for me. I never had the patience for it. But teaching nursing is completely different. Like if you love what you do, it makes it easier. So I became a preceptor. I started training a lot of new nurses that were coming in. About 3 months after that, give or take, I became a relief charge nurse. So about 1 to 2 days a week, I would fill in and be the charge nurse of our unit, which was another big step, but I actually really enjoyed it. 2 years in, I became assistant nurse manager. That was after I had delivered my first baby. So maybe it was a little later than 2 years in. Now that I'm thinking of the years, close to it, maybe 2.5 years in, I became assistant nurse manager. So while on maternity leave, or before I even left for maternity leave, that role was open. I kind of contemplated it, but I wasn't 100% sure. I had worked day shift before, and this was a night shift position. I was kind of apprehensive about that. I didn't know if I could do nights. I never really wanted to do nights. So while on maternity leave, my spouse and I spoke about it. I really went back and forth numerous times trying to figure out if this was going to be the next step in my career. So we finally got down to the decision that I was going to take on this role. We were going to have to work as a family because now I'm going to be working night shift with a new baby, breastfeeding and everything like that. 3 months of maternity leave, I accepted the position. I spoke to my manager while on leave and told her, I was looking into it, and she was gung-ho for it. So she really helped with the process, and it was an easy transition. I was assistant nurse manager for about 1.5 years. At that 1.5 year mark, I had delivered my second baby. My children are 364 days apart, so, or at least my 2 oldest are. So I came back from delivering my second baby. I stayed for about a month, and I had already expressed to them that I was going to be leaving. I was going to go and do some travel nursing to a city that wasn't too far from home. It was about 1.5 hours away. Just because it was my first assignment, I was nervous about leaving and everything like that, and I wanted to be able to bring my children back home to see their grandparents and everything like that. So we went about 1.5 hours away. My spouse and my children came with me. I don't think I would have done it if they couldn't. And I actually really, really, really enjoyed travel nursing. So stay tuned for that video in the future. So I did that. I was in that location for 1 year exactly. I had 3 contract extensions with the company and with the hospital that I was at. And the only reason why I stopped travel nursing was because I became pregnant with baby number 3. So it was going to be too hard for me to stay in that location and come back to my OB doctor here, and I had 2 good experiences with him, so I didn't want to change it up with the 3rd baby. So we decided to come back home. I took a month off to spend time with family and just enjoy our time together. I really wanted a challenge. I really wanted something that was gonna help me learn, see something new. When I was on the med-surg unit, I travel nursed as a med-surg nurse as well. When I was doing med-surg, I really found myself starting to get bored a little bit. I felt like I knew everything, not a know-it-all, but just I wasn't learning anymore. So long story short, I found this position, which is my current role as a trauma surgical ICU nurse. Last month, July, just marked my 2 years on this unit. And honestly, you learn something every single day. It is the best decision I've made. I'm so happy in this role, and I fear for when I do want to leave, because I feel like anywhere besides there is gonna be like so slow compared to the fast pace that we're working in right now. It's really enjoyable. You get to see different things, and we'll talk about the nitty-gritties of that later. I also have a part-time position. It's really PRN, but it's at a long-term acute care hospital. I worked at one of these facilities as a CNA, and I really found that I learned a lot there as well while I was in nursing school. So I work there like once or twice a week, just depending on what's going on, if they need the help or not. And yeah, that's pretty much where we are today. Currently, I am on maternity leave, so I get a little break from everything. All right, guys, so that's the end of this video. I hope you enjoyed it. Please don't forget to like, comment, and subscribe. Let me know where you are in your path in nursing. What roles have you taken? What was your favorite role? What was your least favorite role? What would you say you would absolutely never do? Thanks for watching this video, and I hope to see you in my future videos. And until next time, don't forget, stay safe, be well, and live well.